And I would be in the car a lot, even if I had to go to the office.
Sure. Yeah.
So a lot of our portion of the state though, so.
So you're going that way.
I am.
You're already there.
Yeah.
So that's good.
And we have a couple in Wisconsin, 2 in Wisconsin now, and one.
Oh,
Yeah. Just hard to straight. Just be like, oh.
mm-hmm.
No.
Sure.
So do you park in the bathroom?
This does, or this one. Yeah.
Okay.
Just listen. No, we, oh, yeah, the student recommendations based on.
Yep.
Versions. Get them today.
I'm going to ask people if they could just test their microphones for those that are online. Michonne, can you test your microphone?
Good afternoon, everyone.
All right, sounds good. And is Lisa on there? Andrea is no longer. So is Lisa Anthony Thomas there? So if you hear me just talking back and forth with Gia a little bit, she doesn't have a voice today. So I'm Gia's voice for testing some of our equipment. Is there any other?
Did you see? You can't unmute herself?
Oh, okay. Not unmute herself. All right, well, here's you, Genevieve. Okay.
Yeah, hi. Good afternoon.
All right. Okay, so Lisa is there, but she can't unmute herself. Okay.
Oh, wait. Hi. Can you hear me
There
now?
we go. Yes. Okay, there we go. So Gia just has to come up and then your mic will work. So if there's anyone else online, council. Try to just wait just a moment. We'll get our technology out and then I'll make some introductions. I know, I'm just kidding. That's all right. I know I'm running back and forth. It's like, oh, get this. Okay. All right, so it looks like we're good to go. So we're going to start our meeting. This is our meeting of the Home Care and Advisory Assisted Living Program Advisory Council. My name is Daphne Pons. I'm the Executive Operations Manager of the Assisted Living and Home Care Program here at MDH, and I'm serving as the chair of the Advisory Council. We have a number of our council members here with us today, as well as a couple of members of the public that are in the room. We also have council members that are online, and everyone's microphone should work if you're online to be able to unmute and discuss. I do want to welcome Lisa Anthony Thomas here today. She's a new council member. She is replacing Andrea with the Office of Ombudsman with Mental Health and Developmental Disability. She's the new Deputy Director. And so we just want to welcome you, Lisa, to the council.
Thank you. Happy to be here.
All right, and so for the agenda today, sitting to my right and in here is our Assistant Commissioner, Carol Backstrom. And we invited her and she wanted to come here today because at our last meeting in June, I believe it was June, we had finalized the recommendations of the council for things that the council would like to see going forward for this year. In particular, recommendations of how we would like to use, or you would like to use the money that is in special revenue account that comes from the fines, from correction orders with providers, and how we might be able to do some things that would move home care and assisted living in a positive direction going forward, and how best to utilize those funds. And my understanding is that Carol has reviewed those recommendations, and she's here to just have a conversation, I think, with you all. And I will hand it over to Carol, and I'll assist you in any way you would like me to.
Do you all know each other? Like, should we do introductions? Would that be okay if we spend some time with that? Okay, that'd be awesome. And before we start that, I need to leave about 1:45. That clock is fast. I have only 5 minutes after the hour, so nice work getting going.
Yeah.
But if we could start with introductions, that would be awesome. And I could say a few words about myself too. So let's start in the room. Do you want to start first?
Sure, my name is Ruth, and I'm not a part of the council. I'm just a member of the community that's
Fantastic.
interested in having home care, assisted living, just trying to learn more. I called, and what the operator suggested it come in a little bit earlier to get some questions answered, but
Maybe we can try to do that during the meeting?
Yeah.
Okay, sounds good. Thank you.
Hi, my name is Miss Lowe, and this is my door, and we're here together for information to see what's open, what's available in this industry for us.
Wonderful, welcome. Thank you for coming.
I am Jared Peterson. I'm on the council. I represent basic home care providers.
I'm Anna Peters-Meyer, I'm also on the council, and I represent assisted living providers.
All right.
I'm Megan Leach. I am the Director of Public Relations, Research, and Practice Act for the Minnesota Board of Nursing.
Okay. Great.
I'm Pat Fitzgibbon, and I'm on the council.
And who do you represent? Are you a member of the public or are you a public? Wonderful, thank you.
I'm Houghton. I'm not on the council. First time being here, so I'm just new. I'm trying to learn what it's about.
Wonderful. So are you a member of the public or are you on the council or?
I'm not on the council. I'm a provider.
Okay. But you're not on the council, but you're here because you're interested in all these issues.
Exactly.
Wonderful. Thank you for coming.
No.
And it's Holcomb?
Houghton, Hothan.
Thank you.
Yeah, hi, my name is Samira Isa. I'm on the council and I'm representing assisted living providers.
Oh, nice to see you.
Nice to see you too.
Hi.
Hi, I'm Kathy Mesterly with the Minnesota Home Care Association. I'm not on the council, but just here to listen in.
Nice to see you, Kathy.
Hi.
Are you here to help? Well, welcome anyway, thank you. All right, let's go to the phone. Let's go, I'm gonna start left to right, if that's all right, and Ted Young, you're first.
They won't be able to because if they're not members, then
Oh, okay,
the
oh,
only members that can.
I have been informed that only members can speak. Well, hello, Ted Young and Sheena, and Tanish Schmidt,
And welcome.
and Gia Vang, and welcome, glad you're here. And Michonne, I know you, if you want to say hello.
Yeah, I would love to. Michonne, Michonne Shetler, and I am with Care Providers of Minnesota. I am representing long-term care providers, and happy to be here.
Hi, thank you. And Genevieve.
Genevieve Gaborio with the Deputy Ombudsman for Long-Term Care, representing the Ombudsman's Office.
Wonderful, thank you. And Lisa, are you a newish member? Did I understand that?
Yes, yep, Andrea Cerebral Ayers is retiring, so I'm taking over her position from Office of Mental Health and Child Mental Disabilities.
Great, thank you. All right, so did I miss anyone else on the screen who's unable to speak? All right, well, welcome, thank you, everyone. First of all, council members, thank you so much for the recommendations. I'll get to those in just a few minutes, but what I was hoping to do to start with is to introduce myself and just kind of talk a little bit about my role here at the Department of Health and in particular my interest around assisted living and home care and nursing homes. And then if it's all right with you, I'd really like to ask some questions of council members. Like if you could help me just get a little bit of the lay of the land about, what the role is of the council, the advisory council, what's been a little, you don't have to go through a lot of history, but even just getting a little bit of a sense of how you see the role, like what you think the role is and how you sort of demonstrated that in the past. I know there was just a ton of work done in standing up assisted living licensure, for example, over the last 5 years or so. And so we don't have to rehash that, but I would share with you that I'm very interested in the work of this council and how we can utilize you going forward, utilize the opinions and the expertise that are on the council. And I'm very open to hearing what your thoughts are as it relates to that. And I would like to plan on attending as often as I can, if you're open to that, because I'm really interested in these issues. So let me just, a couple words of introduction first. I have been with the department now for about 1 year as an assistant commissioner of the Health Systems Bureau, which includes the Health Regulation Division, as many of you know. That includes all of our survey work and our licensing, health professions licensing, as well as facility licensing. So all of the complaint investigations and work related to the quality and safety of our older and older residents in Minnesota. And prior to being back here at the Department of Health, I was in consulting. I've been spending a lot of time. I also worked for about 5 years out at CMS in Baltimore and DC for the last 10 years. And so I know Medicaid programs pretty well, but more on that policy level. So I've never really lived and breathed, for example, waivers and reimbursement for the various waivers. I was more in the role of helping states negotiate waivers and figure out how to report on waivers and things like that. So my background is really more on like the health policy, Medicaid policy world, rather than direct service or even really implementing those programs on the state side. Although, having said that, I did serve 1 year as the Medicaid director over at DHS, but it was already 11 years ago, which, in the world of Medicaid is a long time. So I was also with the Department of Health here about 15 years ago. So I've been in state government or federal government for a long time. In this consulting land that I lived in, I did a lot of Medicaid program work with other states. But I'm very happy to be back in state government. I care a lot about the areas that I have responsibility for. The other area is health policy. The other division that I have responsibility is health policy, and they do a lot of the number crunching for statewide information around health, around access, how much we pay as Minnesotans. We do a lot of surveys. We do a lot of reports on different types of healthcare services. For example, we're about to put out a report on the use of telehealth and its usefulness and its effectiveness and where it has limitations. So like they look at things that kind of at a macro statewide level. And then the Health Regulation Division, I have to admit, has been pretty new to me. Like, in the world of Medicaid, I've certainly been familiar with long-term care and community-based services and their array of options, especially as it relates to Medicaid reimbursement. But certainly on that regulatory side, this is pretty new to me. So Daphne can attest to the fact that the learning curve for me has been really pretty steep in terms of learning just the challenges that exist in the community, especially as it relates to assisted living and navigating licenses and DHS and waivers and reimbursement. And again, like familiar with the issues, but really being in this role and learning about the challenges has been, you know, on a day-to-day basis or week-to-week basis has been new to me. So I've really enjoyed it though, because I really care a lot about long-term care for our residents in Minnesota and doing the best that we can do. And I know it's a complicated world, and I'm sure we could fill up the rest of the afternoon talking about various issues, but that is getting to my next point, which is, if you wouldn't mind, if any of you are willing to kind of talk about your experience being on the council and sharing with me what you see the role is, because I refreshed my memory before walking into this meeting that it's not just the collection of the penalties and the expenditure of those penalties. I get that that is just one piece of what you do. But if you could tell me a little bit more about, you know, like I said, the history or how you see your role, I would really appreciate hearing directly from you and what your experience has been. So if anyone's willing to jump in, please do. Anyone online too, of course. Yeah.
I'll go. I've been on the council since, you'll have to check me, I think 2016.
Oh, good for you. And thank you.
Yeah, and I'll be frank, I'm kind of frustrated because we spent a lot of time in the first couple of years putting together some pretty detailed recommendations. At that time, the statute called for recommendations to be made to the legislature.
That's right, there was a change, wasn't
And we did that, and in the two times we made recommendations in 18 and 19, I think, we got no response.
Just nothing at all?
Nothing at all. We got one or two of we received your information. If you're a constituent, we'll get back to you on this site, such and such a date or whatever. We sent it to the majority and minority leaders, the associated committees that dealt with older adults, long-term care, and got nothing out of it. So a little frustration there. COVID hit, and then we kind of shifted gears a little bit. And found out a way to distribute some of the funds through a engagement grants, basically technology to allow people who've been isolated
I have read about that.
typically in facilities, to be able to purchase some items to deal with that, that social. Started out social isolation, we changed it to social engagement to make it a little more positive. Coming out of COVID, we need some more of that. So, and then now we've kind of shifted back, I think, to let's look at making recommendations again, because it feels like, and hopefully, we have the ear of someone who will actually perhaps listen and take action, as opposed to sending it out into the ether and not seeing anything come. So that's a super abbreviated version. Anybody else can add on to that as you want.
Did the council play a role in standing up the licensure, assisted living licensure? Like I've understood that, really?
No.
That's my understanding, yeah. Okay. So it's really about the funds. It's really been advising us.
So, yeah, I mean, that's a big part of it. I think that, that's what the statute says to do, right? I think that the bigger part, for some on the council, myself included, is to make recommendations to make providing care better, and maybe look at some of the regulation and what makes sense, what doesn't make sense. A lot of that happened on the assisted living side, I think, and AL folks can correct me here, when after the licensing, they all kind of got together and said, hey, we did this in August, now let's kind of fix some things up. And I think that's where the focus has been for some of those groups and not necessarily us. I think we want to try and get back to, can we make recommendations? And then if there's funding that's necessary for those recommendations, then that is there.
Yeah.
And that's not, and Daphne kind of crystallizes this for us a little bit in that we don't have to figure out how that gets done, which is probably pretty good because it's probably not the expertise of the group as a whole. It is figuring that end out of it. It's just making the recommendations and let the professionals that do that do that.
Yeah, perfect.
So,
Thanks.
any more questions or anything from that?
I don't think so, but I'm happy to keep going. going on this. Others want to weigh in?
Yeah, there's others that.
Yeah, hi,
So,
this is, oh, sorry. Do you want to go
Go
there and
ahead.
then I'll go next, or? Okay,
Genevieve,
well,
go
so-
ahead, yeah.
Okay, so I'll just add on to that. That was a good summary, Jared. And I've been on the council, I want to say since 2021, so sometime during COVID. So I missed those previous letters to legislators and the commissioner. So I was not part of that. But I was really proud that the council did find a way to spend some money, because it's my understanding that we really have been collecting and not been spending. And so I loved how we worked, and it was when Lindsay Krieger was leading, and then she's changed, and so it's great to have Daphne with us now. But we had 2 rounds of these kind of micro grants that providers could ask for, and they were really things that providers could use, but that helped residents maintain social connection. And so it was a win-win for both people. And I know that there's a number of other grant processes that DHS has, that health has, that, certainly we can use this funding that we have towards the recommendations. But I'm also hopeful, this is not the first time I've raised this, but I'm also hopeful we can find some other annual process or some sort of useful micro grant that we could, this money going out the door.
Thanks, Genevieve.
I'm Anna Petersmeyer. I have only been on the council for a little over a year now, so I'm relatively new. So this past year has been very interesting. I think
Is
this.
that like a Minnesotan way?
I think
Like,
so.
I'm very-
I'm actually, yeah, Midwestern maybe.
Okay.
Yeah. I think the council has some opportunities to be more effective. And one of the things that excited me most when I applied for being a member is the opportunity to really deepen the relationship between the public and providers. And so I think we have that opportunity to do that, as well as, align ourselves with the mission of the council, which is to really provide safe and high quality to citizens. And as a provider, I really appreciate the opportunity to have a voice representing assisted living and then also with home care. It is a little bit more challenging now that 2 industries are more separated. So there's a little bit of a competition.
Sure.
In terms of investments and resources.
Okay, thank you. Did you want to jump in?
Yeah, I wanted to second what Anna and Jared said. I've also been on the council for around the same amount of time, I would say like a year now. And it's definitely been interesting too. This is like my first round of seeing the recommendations and kind of seeing how everything is happening. But one thing I will say that I think MDH is definitely doing good is kind of looking back and seeing like, is everything we did potentially too excessive, right? Like, like regulations wise, like, being able to provide high quality care, having those regulations are important in general. But one of the things that have been a topic of conversation is, is this something that we should like continue to with these regulations kind of continue on, or is there a better way where we can provide the same amount of care, but maybe have a different regulation or a different route to go about the same thing? So that's just something that I've noticed definitely.
Great, thank you. Anyone else?
Yeah, Carol, this is Michonne.
I'm Michonne.
I too have just been on the council just this year, and I'm excited that we have recommendations. I think as a council, we really want to see that money spent getting back to providers, as well as really helping improve quality for the residents. And so, like anything, getting started and gaining momentum can be difficult, but I hope that we can be pretty swift now as we move forward to really make a difference and to start spending those dollars, because the account has gotten pretty high. So
Yep,
which is also a huge opportunity.
yeah, totally, that's, yeah. I don't wanna cut anyone off, so if there's anything else you wanna add, please do. Otherwise, I'll kind of jump into the recommendations and the conversation about, what's next. So, I'm with you. I think we should really think about how we can best use these funds. And I am all for figuring out how to get the funds out in the most effective and useful way for residents and providers. I would say providers are a key factor in this because I think making sure providers are equipped to take care of people is a big part of navigating this world. And so the recommendations, I looked at the memo, I had a conversation with Commissioner Cunningham about the recommendations, and her reaction was really around encouraging the council to think even bigger. So I hope that this comes as an opportunity to, again, sort of think about how best to use the funds. And a couple of the recommendations are along the lines, I think, of what the commissioner is thinking about, which is how do we best equip providers to navigate the license process, to get ready for licensing, and to get ready for surveys, the initial, especially new entrants to the market, but also those who are already in the market. You know, I think about training. I think about, again, navigating that regulatory process in terms of ongoing surveys. And I would include home care in that as well, for sure. And I also, if you can't tell this about me already, I am a relationship builder. I really think that if there's a way that you can help encourage MDH and how we think about partnering with providers, and please don't mistake that for not hearing the voices of residents, because of course that's super important. But I really want to think about how we can best use the funds to work together to improve the industry. And what that looks like exactly, you have the ingredients in those recommendations, but I'd like to broaden it. I'd like to make it bigger. We have been talking about doing more work around license navigation. We've been thinking about a legislative proposal around license navigation, and again, ensuring that, especially in assisted living, that providers are prepared for what they might be entering into, and making sure that staffing is there. I also think about the fact that assisted living as a statute is going to continue to evolve every single year, right? As it's looked to, as assisted living and home care is looked to more and more to serve residents and help people stay in their homes or get the services they need in somewhere else. I think assisted living is going to continue to expand, and I can picture where we're going to have a lot of different types of assisted living, and that's, you know, down the line. But in terms of, you know, what I keep hearing about are people who are in acute care settings in hospitals, but we can't discharge, right? Because there isn't an appropriate setting to go. Assisted living is going to be looked to more and more for that. And I think whatever the council and these funds can do to help serve residents that are more difficult to serve, that includes staffing, that includes training, that is very much an interest of the commissioner, and, you know, is in a public policy kind of way, an objective that I think we all want to work toward. So let me stop there and just get your reactions about specifically the fact that I'm saying great recommendations, but keep going, because I know you want to get this out the door.
So we did have one comment.
Okay.
Yeah, that was online from Karen Webb, who's been on our council since September 2023. Represent a person who has or has had a family member living in assisted living, is her position. It's been a learning experience. I see the role as making the living conditions and care in the facilities better for residents. I see that from my time on the board, we need better communication between the facilities and DHS and more education. I just wanted to make sure you read that comment.
Thank you. Comments, yeah.
Yes, I had a question. So about kind of thinking bigger, what would you say are some ideas related to that?
Well, I'm hoping you can think about that too, but I mean, or how about this? I think about technical assistance, right? And that means to me, capacity building. Like, can we figure out how to build a network of shared learning that would involve, I don't know, you know, I know that I have to walk a line around sort of our surveyors, but the expertise that we have at MDH to help provide the expertise in being ready for surveys. But I also know it doesn't necessarily have to be an MDH role. Like, I think about it like, you know, there are people in this world who are just experts at this, right? And is it a matter of contracting with an organization that does this all the time, that does training, that helps providers navigate that license between DHS and MDH and making sure that, you know, you're ready for that survey? Is it the U of M, for example? Like, are there people that we could contract with? That's an idea. Like, it does, that's what I mean by thinking bigger. Like, or should we create some kind of public-private partnership with DHS? I mean, I think DHS is really interested in making sure that that providers, you know how to navigate licenses and waiver services and things like that too. So if is this resonating with you all? I mean,
No, and I think that even in our conversations, we've seen a bit of a change because it's always been, not always been, it's been kind of the feeling of the providers, some of them advising that the survey process is kind of an us versus them, and it's not collaborative. And I don't know if it's woven into the recommendations as much when we shorten them up, but that's sort of an important thing is that, you know, you should be almost welcoming the surveyor because they're going to help you get better. And it feels like it's a gotcha situation where we're going to see what we can do. And, you know, anecdotally, we've heard of surveyors saying, I'm here, I'm going to find something. That's not the attitude to have, you know, and I'm not here to consult with you. You know, I'm just here to make sure that it's
and what can we do in advance?
Yeah.
You know, in terms of that joint.
And, you know, and there's a great start. There's a lot of preparation materials if you make use of them as a provider on the MDH site. But the problem happens for a lot of folks if they maybe are new to the industry, haven't been doing this for a long time, and they think they're interpreting the statute right. And we've all read the statutes. That's not exactly, you know, super clear, right?
It's very difficult.
And so if you interpret it wrong, but your intent is correct,
right,
you're still getting hit, you know? And so not only are you getting hit with an additional fine, if the surveyor is not willing to collaborate with you, you're not even sure how to fix it. And, you know, and then you go, well, I'll try this. No, that's not good. No, I'll try that. No, that's not good. And it should be more of a, okay, here's what we want to see, you know? And it's sometimes really difficult, and especially if you're new, I know a lot of the newer assisted living providers, especially that you represent, are smaller, not the big facilities, but smaller homes. Sometimes, you know, people new to the country, all kinds of different obstacles that are in their way. We need to remove those obstacles so that those folks can provide, and particularly if it's to specific communities that are underserved, and we can do better.
I also wanted to add another thing. I think being able to have, like, my goal hopefully one day is that we have MDH directly working with these providers. So something where it's very much so on the ground, we're actually seeing what's going on and helping people, you know, like you're saying, be more collaborative instead of kind of this whole us versus them mindset. But I just think something that's a lot more direct and on the ground would be really helpful.
Do we know if anything exists in other states, for example? I always look, I mean, coming from Medicaid, it's always like, how does the next state do it, you know? And are there examples, and maybe you all know, or maybe Michonne, or like, if there are places, you know, that are, or like this is already in practice, they've created something that is more, it just looks different, and it's more either collaborative or, again, I call it technical assistance because that's another term we always use in Medicaid around, like, how do you prepare people in advance, or how do you educate and, you know, work together on something, and how do you exchange learning together? Like, that to me is, shared learning is a key component in this, learning from each other. I'm sure you do that already, but like, how could we play a role in that?
So we have providers and we operate facilities in Iowa. And Minnesota is by far the most challenging state in terms of just the sheer volume of rules and regulations that one needs to follow.
Sure. I'm not surprised because Minnesota always has to go, right, to the nth degree.
I mean, we should in some ways be proud of that to be
Yeah. Yeah.
And there just seems to be a big fear of risk that doesn't seem to be present in the other states.
Okay.
So when I'm on site going through a survey, we just had one in the it is very. There's moments of teaching while the survey is. We've never heard of a surveyor go back. I can't tell you how to do your job, so back it's right there. So there is a lot of opportunity to be promoted, and that really comes from the top down expectation that come in a partnership manner rather than I want to get you. I have been in the assisted living industry for 25 years. I have seen a shift in just the mentality of the surveyors in the last 5 years. Asking for feedback after the survey is done, and then being more transparent of what the feedback is would be the next great step. And so there is a movement there. I think there's a lot of opportunity, especially if the commissioners are bigger and ready to be more collaborative. We have lots of opportunities with just that step.
Do you feel like this is enough of a conversation that you could start thinking about like meat on the bones of like what a vision or what a collaborative kind of environment might look like? I mean, this is only the first conversation, but I mean, and I know that we want to try to work quickly, and I'm committed to keeping this momentum going.
I would like to take a step back. I represent a very small provider. I've been in the providing care for the past 15 years, but we started ours 5 years ago. We've been surveyed twice, great surveyor. And I say lucky with pride because there were times where they would call back and talk to their supervisor and get some clarification. So it wasn't really a gotcha kind of moment, but I do belong to a group of small providers that we hear very awful stories and very discriminatory sessions. I think before we even jump into collaborative sessions with providers, have we talked about collaborative sessions with the surveyors? What we see that is really hurtful is that a certain surveyor would be at a house and different interpretation of the regulations compared to another surveyor's at another house, like which is which. So we're going back to the drawing board trying to teach ourselves, and then somebody saying, no, this was what this person said, and this is how they interpret it. So it just seems like there should be some kind of background collaborative session among the surveyors, because the discrepancy is kind of vast, and it's not helping us.
And when I think about collaboration, I do mean surveyors too. Like joint, I don't know if it means joint training or again, sort of like what that curriculum would look like or how that would work. But I love the idea of like building relationships, meeting, and talking through issues and things like that. So thank you. Yes, I hear you.
Yeah, Carol, so MDH is doing a collaborative systems change process. And what I've liked about that process is it's taking the blame and fault away and really trying to solve problems. And what I would say is that we've kind of gotten into a very punitive kind of state of mind. And we have to, I know when I managed employees, that never really worked well. It really is about preparing people, making sure that they know and have the tools and skills to do their job. And for some reason, providers sometimes feel as if it's all kind of just put on their shoulders to care for the public. And then when there is a negative outcome, it comes with more regulation. And I think we need to take a step back from that, and we really do need to really all want to care for the community and the public and work together. So I like what you're saying. I think that instead of kind of finding fault, certainly there's minimum standards, but it's really taking those barriers and roadblocks away and really wanting providers to be successful. When providers are successful, residents are going to get quality care. And so it's really important that we take away this us against them, really work together to make sure providers understand how to operate in the landscape of regulation. But also, I think when you have a learning session where maybe surveyors and providers are together, it's not just the surveyors telling the providers what to do. It's the providers really giving the practical day-to-day operational, how am I going to implement this? Because that's really where the rubber hits the road, and it doesn't always look the same. And that's where we can see real hiccups come into play that maybe aren't understood fully. So I think it really is more relationships, continuing to work together, and learning is not one way, it's going both ways.
Hello, I agree with that. And I think from my time on the board, when the person applies for the license, there needs to be education from the very start. With the DHS, with the provider, with any other people that come into play, they all need to be in one group. And so that the new people or old people can ask questions, because one person's question, somebody else may have that same question and may be afraid to ask it. But if somebody else asks it in a group setting, you get the information, and there's things that other people don't think of when they're just with one-on-one with the, the surveyor. And I think it's more meaningful when they're in a group and some people have some of the same issues. Now, I can only take this experience from when I worked at Revenue. We had to go to a class as an auditor to see how this was set up with the federal government and the state government. And there were all types of people. I mean, from big companies to little companies on these tax questions. And that's the only way you can get the people together to see what they need, because some people don't know what they need. So that's my thing on the education piece.
Yeah. Well, and we might want to consider, and this was a kind of a previous recommendation from years ago, is starting at the very beginning. Because if you're going to start an assisted living home, there's a lot of money that's going out. Even if you're doing home care, there's still a lot of money going out, and people that do that, generally that's their that's going to be providing there. So you want to make sure that those folks know what they're getting into, that they're prepared for it, and so people have the opportunity to say, oh, wait a minute, before I spend a couple $100,000, that I know what I'm doing here, and once you've done that, you're in the weeds already. Now I got to make it work.
Now you're committed.
And then, and then there's just so many more opportunities to fail there, rather than just have that opportunity to opt out early on and say no. And whether it's preparedness to do you have all this stuff, or this is what it's going to take. Some more education right at the very front end, buttressed by more education as you go along, as you get deeper into the process, where you're done collaboration with with MDH staff and how whatever that looks like.
What I'm hearing is almost like a continuum.
And then there's also, you've got city regulation, county regulations. You've got a lot going on just in this one home. So all those people need to be involved.
Yeah. I do have to go. I thank you. So I hope this was enough food for thought. I know I'm leaving you with what I feel like is a lot of work, but I also hope that you see it as an opportunity. And Daphne, I don't know how best to describe next steps, but, you know, I'm committed to trying to even get, like, I am willing to get into the details. And so, you know, if it would be helpful to figure out how to, you know, if a subgroup wants to come together and kind of put some, you know, thoughts together, or a work plan or a tentative plan together, we can go from there. What do you think?
Well, I think if you leave, I think we could continue to have conversation too, while it's on people's minds. And then, we can always typically order, but we can always have the option to meet more than that. So if we want to meet sooner, earlier,
I know it's a commitment
we can do that.
for you to go through this, so I appreciate it very much. I'm in it with you to help navigate it and help guide if that's helpful. All right?
Appreciate that.
Okay, yeah, well, thank you for letting me come, and I'm happy to keep talking, and Daphne, if you want to throw my contact information in the chat, or I think you all know how to get a hold of me. I'm on the webpage.
Yeah, and I can email it out too.
Okay, that's follow up now.
Thank you.
Thank you, everyone.
Thank you.
Take care. You too. I'm going out of town for 10 days, so that's why my husband's coming to get me as we speak. Bye all.
Enjoy. All right, so we can continue that conversation if people would like to talk more about.
Well, I think we've always been about preparedness, right?
Mhm.
Of getting people the tools they need to decide if A, this is right for them, and B, if it is, how to move forward most effectively. I mean, I know when you get your, you know, provisional conditional license, whatever, you know, that you get started there, but you know, do we have a mechanism for people who are thinking, hey, this seems like a good idea, for them to have something to say, oh yeah, that is a good idea for me. That is those are my goals. That's what I'm looking for. Now I understand what I'm getting into, as opposed to, you know, somebody who says, this is a great idea, but doesn't, you know, have the tools.
I also wanted to circle back to something you mentioned earlier with like having different surveyors come in, and one surveyor is telling you one thing and then another one's telling you something entirely different. I really think that whole standardized forms idea would definitely help with that, because if you have, I mean, we've done it before, but if you have all of the, you could say major or most important forms that are standardized, then it's like when the surveyors come in, they're just checking for completion, like we spoke about, right? So that also, I think, kind of cuts down the time of going into every home and then being like, okay, this kind of having to sit down and analyze everyone's different IAPP. One person has it from one consultant, another person has it from another consultant. This just kind of simplifies that whole process. And I just think that would kind of cut down a lot of time and confusion for sure.
And I think we all acknowledge that they're people, right? So there are going to be differences there, but I think if you can iron out some of those variations as much as possible, I think that would be helpful.
Yeah, try to make it a little bit more objective.
Well, then if you get a standardized form, it's hard to find stuff too.
Oh, exactly.
You know, if you've got your own stuff and it's all over the place, you know, you could hide things that were undesirable. Standardized form, everybody's got the same. You can't hide anything.
Yeah.
Right, so that does make the surveyor's job easier.
Daphne, did you send out the formal recommendations that were sent?
I sent a copy of the letter that I thought that I just, what ended up happening is it went to, up to Carol. And then I think it was refined a bit more and looked at, and so I don't have what the final letter is. And so I think there were some more discussions, with Carol, and with Maria and Lindsay, looking at the information. And so I didn't send that back. I can ask about having a copy of that sent back. That was my intention. There were still some levels of review. It went through going to Carol, and so I can see about getting the final copy to the advisory council.
Yeah, I think that'd be helpful to have. And then,
I mean, if we're gonna go bigger, I wanna know what that looks like, right?
What's the timing?
Or
So these recommendations are being reviewed, time wordsmithing probably at this point and intentions.
I think, my understanding is what Carol is asking is to see how we can have further discussion to operationalize what you want, and then also, like she's saying, potentially go bigger. Go bigger can mean a lot of things, I know, but I think because a lot of what been talking about with the recommendations around a lot of external education and outreach, and honestly, that's something that there's not a lot of within our health regulation division, because our primary task is complaint investigation and survey work, and so we don't have like a dedicated staff to just provider outreach, just provider education. And so thinking about how to operationalize that, whether we think perhaps is that through outside consultants, like a separate firm, separate from MDH? Is it built into MDH? Is it, how would we think about operationalizing that? And so I don't know. I think we would like something done yesterday, because we just want it done and helpful and out there for providers. And so really, I think it's digging into how we think we could operationalize that, what would be the best way to get some of those outreach efforts and education more formalized. And I don't know exactly how long it would take to do that. We have the funds sitting there to help support it.
Well, I mean, if you're gonna internalize it, right, then you're talking about hiring a person or more, and then you've got wage, benefits, all that stuff, and if the project continues or if it stops, then you've got that person, right?
Mm-hmm.
So it almost makes more sense to start out looking at, do you outsource this? Because you can always end the contract if you need to, or if something changes, or if
Well, the source of the funds are fines, which is unstable.
Right.
So you never can make long-term plans based around a funding source that isn't substantially stabilized.
I guess in my opinion, this is just my opinion, I would avoid the outside consultants, because to me, you're just adding an extra layer, and you really don't know if that person is going to interpret the regulations any better or worse than the surveyor. So I think it should be somebody from MDH. That's my opinion.
Yeah, I want to second that as well. That's kind of the line I was thinking along as well, because that kind of gets rid of the whole, a surveyor could say, well, the consultant said this, but we think this is MDH, and the whole, it kind of just gets rid of that middleman. I think maybe there could be something where there's like a work group or something for people who are already working at MDH, and even potentially people on the board working together. Yeah, I mean, I agree with not using the funds for like employee salaries and stuff like that. It's unstable. I think there's like a middle ground.
Well, I mean, and there's expertise out there, right? There's care providers, there's leading agents, the Home Care Association, that maybe they want to take a stab at a contract on providing we put out an RFP for an orientation program to home care, to assisted living, however we decided. I mean, there's options out there that we can kind of do the best of both worlds, where the kind of the legwork gets done by an outside source, but the implementation and the ongoing is through staff.
I'm gonna step back just for a second, because I don't know if we have to be as, we can figure out the funding piece a little bit down the line. There's a lot of money and more money keeps coming in. The goal is clearly to have less money coming in because providers are understanding the law better. And so maybe we'll work ourselves out of funding at some point. That's a good goal. But I just was gonna say, I like the idea of education for providers. And if we're gonna do this, it would be nice to also have education for and I'll turn my video off because I think my internet's bad today. It'd be nice to have education for residents and family members too about what does it mean when there is a licensing survey? What is a provisional license? What are complaints? You know, because we just hear a lot of things from residents who don't want to speak up. They don't really understand. They don't want anyone to get in trouble. And so if they can be a better piece of raising concerns to providers and raising concerns when they're necessary to the state and understanding how that all works together and that it ultimately benefits their care and the next person's care, and helps train the providers to give better service. I think that would be nice to have a component for the residents too, if we're going to be spending a chunk of money on this process.
Well, Genevieve, even just the lack of understanding in the different levels of care and kind of expectations. So definitely there's just a lack of understanding all around at times, and I think that's a great call out.
I think there's a huge opportunity to educate the public, not just family members and residents. Some people come into our communities or into our agencies informed. That helps everybody provide better care.
Well, wasn't there kind of a push to do that to the MDH website to provide more education to consumers, or more information to consumers at least? I mean, I know they've got the survey results, and you can look up whatever agency or facility that you want, but is that an opportunity too?
There is a report card.
Yeah, there's the assisted living report card that's being implemented. But that's not run through MDH, but through DHS, using MDH data. There's some information on our website, but I wouldn't say that there's in-depth educational tools to say, like, this would be your experience. Here's all the questions that you would want to ask going into an assisted living, or if you're considering care. I know maybe there's some other outside organizations that have some of that, but the MDH website does not have a lot of in-depth tools.
No, we had talked about that. Maybe it was just in the council that we talked about that.
I would caution people not to use the report card as an educational tool.
Well, we do, I mean, an idea is that it can be kind of both and. I mean, the funds that are in the special revenue account that we don't know, once we spend the money, we don't know what the funds will be year to year. There are time-limited projects that we could say, maybe we're wanting to do a real education, called education blitz, whatever, with providers and family and residents, where you have some education and tools. You could have maybe an outside consultant or a firm put together, nice little videos, and it's got good production value, and there's all these things that could be created that we know will be good for at least 2 to 3 to 4 years. Like, this is what it means to get into the assisted living business. This is what it means to be an ALFPC versus an ALF. What it means to questions that if you're a family member, you should be asking or understanding about the services that could be provided to your loved one, or services that may not be able to be provided to your loved one. Here's questions you could ask. So those are maybe time-limited things. I guess I'm saying it could be both and. It could be a piece that we want MDH long-term to be able to do that might have to go back and ask for funds and appropriations for an ongoing maintenance, I guess. But then I know there's this great need now for education and push now, because they're, and I'll give an update here in a minute, but pretty much everyone that's licensed today will have been through their first survey next 3 to 4 weeks. So they'll at least have experienced it, for better or for worse. They will have experienced it and have hopefully better understanding, but we still know there's this big gap in people still coming in to the licensure, and still in the licensure now. It's just perfectly licensed provider that still don't understand all the moving parts. There's nothing in the law. So you fill out your application to be, whether it's home care, assisted living, you're basically attesting to and saying, I understand all of these things. And you in good faith just have to say, I understand all these things, whether you actually in reality understand them or not,
Right.
you don't know till you actually go out. So there's nothing that says MDH, you have to test these folks, or you have to take a class, or you have to know, you just attest to. And so there's a huge gap in between there where there's not a lot of vetting. It's just you check the boxes that you understand, you check the boxes you have the forms and the appropriate, background studies and what have you, plan reviews, the things you check off. But there's a big gap missing there. I think there could be some there could be education there. There could be, a training class to take. There could be other things to at least say, I sat through 8 hours of this information, or and maybe I had a better sense of before I paid my X amount of dollars for this application that I have a better understanding. So I think there's a lot of room for improvement there. If people are signing up saying they know, they think they know, and that's great. They think they know, but once they get in it, like you said, they're in it. Now they just gotta dog paddle and keep going. And it's a struggle when maybe they don't recognize how heavily regulated it is and how complex it is and how difficult it really is until they're already in the middle. Trying to avoid that and get an education before they're in that place.
And I'd want to be a little careful in that, if people want to open businesses, they're not required to take a course. So I'd want to be careful that we're not overstepping as a council to require if someone wants to open a business. But I do think that it's very difficult because of all of the different agencies that have to collaborate together with the different types of licenses, even having at the county level. I thought Karen called that out well, local laws. And the other thing, Daphne, is turnover. So although providers may be surveyed, if key leadership has turned, some knowledge can be lost there. And I think that's why the more solid we have resources that are really consistent, easy to find, because even navigating a lot of the resources is challenging. I can never navigate DALSA, I know now, but it's under application. But I don't know that most people would look there, they just go to forums, right? So I just think we have lots of opportunity to do a lot of things, but also need to be a little bit careful and maybe prescribing a required training versus having it available to help people as they navigate or are looking to get into the profession.
Yeah, I never considered it something we would require.
No.
It would be just a tool.
Yeah, and I know that's just me spitballing, throwing that out, Michelle. Yeah. I know it's definitely, we've been able to see just on our end from survey and complaint investigation that there are a lot of providers that didn't really recognize, particularly if they were comprehensive home care providers before and then making that leap over to assisted living, really to recognize the amount of regulation that's with the assisted living licensure and thinking that they, yep, I understand, but then once we go in and survey, they're like, whoa, I had no idea I had to do X, Y, and Z. Because
well,
it is yeah.
I apologize for interrupting. I would just say that it was quite an undertaking during the pandemic to do what was done. And so I think providers are just wanting to take a breath and get a break. And I think this council has an opportunity to really kind of help. And so that's what I'm most excited about.
It's really more of a mindful approach to you're asking the council to think bigger, but also the council wanting to small.
Yeah.
So I think we've got it parallel.
And that's, I wanted to ask about some of the other things that don't cost money. Some of those, it's like policy type issues. Do we have movement on there? Do we have any feedback on some of those things? I mean, I know we've got the collaborative safety group that are dealing with a couple of those items. And hopefully, it's been a couple of years now, hopefully we'll get some resolution there where we can actually start doing something with it.
I don't have specific feedback from the policy recommendations that were on the list. I know one of them was, some of it was related to the TV and IAPP.
And portability of training and things that we could, without money.
Yeah, so we did have passed, this past legislative session, some portability of orientation requirements with assisted living. Should make a note of that from here, right? So.
Yeah, because I mean, the feedback was kind of, that's coming in assisted living, so just wait for it. Well, it hasn't changed in 144A, so.
Okay. So that can be something I can bring back to Carol and say, we also want to talk about policy decisions, recommendations of policy things that would potentially could come up in legislative session. You know, if there needs to be legislative changes or rule change or what have you, and see what movement we could make on those that are unrelated to finance, certainly, that are really just more.
Daphne, just a comment. There's a lot of comments in the chat, and you said that at each meeting you do capture all of that in, correct?
Yes, we are. I should say that. Yes, we are going to capture all the comments in the chat, and I'll send those out. Gia is going to help me capture those, and we'll send those out to the council, and I'll also send those to Carol, our assistant commissioner, so that she can review all of those and can see what questions are being asked and what recommendations are being made by those that are online. So don't think that your comments are going unnoticed. We'll have further discussion on them, and we'll share them with the council and the commissioner, assistant commissioner, so that she can take a look. Thank you, Rashad. I guess, is there a desire, I'm just here too, is there a desire to meet sooner, to be able to meet with Carol again? Because obviously she said she's motivated and interested to meet with this group. Normally this group would not meet again until December, and I was going to find that day, I think it's December 9th.
Comes back to my question about the meeting. So if they really find recommendations, then we'll go in front of legislation to make a decision here.
Yeah. Well, there are, as far as use of the special revenue funds, those can be utilized, without any legislative action or decision. So those can certainly,
some of the recommendations change in legislation.
Yeah, that depends on MDH interpretation. If we need statute change, right? I mean, some of it can be, there's a possibility that some of it could be.
Statute change, home care to have.
Right.
Yeah.
The campus number.
Yeah, so we're already, so there's already discussions happening about next legislative session and proposals coming forward. I can have discussions with our legislative team if there were things that the advisory council want to bring forward as far as that. I think most of the recommendations really didn't involve a legislative change, so those are things that could be moved on, and the funds that are in the special revenue account be utilized. Without, it's essentially they're appropriated to the commissioner, and then the statutory piece is that the council is able to make recommendations, and then the commissioner helps to operationalize those recommendations. So those funds can be accessed by MDH without further legislative intervention. Yes. So saying all that to say we could move forward with the things that don't require statutory change, that are in your recommendations, and spend money on those. It's not as simple as that. There's tons of forms and contracts that have to be done, but it still doesn't have to wait on legislative session. But if we'd like to, I don't even know if October is doable, but I would have to, honestly, I'd have to take a look at Carol's calendar, to see what, she would be available to do, but we could either meet in later October, we could meet in early November, or perhaps even have some back and forth, trying to figure out kind of maybe what piece of what we would like to tackle first, if there are, talk about both, and if there's maybe a group that wants to tackle, or everybody wants to do it together, focus on the small wins group, like smaller things that we'd like to work on that we think don't take as big a lift as figuring out all the challenges of figuring out external consultation and everything else. If there's smaller wins that we'd like to get, or if they're, I don't know, I haven't thought about what a task force or a separate meeting would look like.
Well, I kind of feel like this conversation left us a little bit in limbo, because I felt like we had some pretty good direction there.
Yeah.
But now adding this element into like the go bigger idea, or like, well, maybe go bigger right now isn't the thing to do, but to let's get the small wins, get some momentum going, and then maybe we want to build to something bigger. I mean, obviously we want to get the biggest bang for the buck, if you will, as we can, but if we can get some policy changes, if we can get some, collaboration between surveyors and providers, like then I think that was still in the recommendations.
Yeah.
I mean, can we do some of those things and kind of build upon that to say, okay, now let's go to the bigger thing, and maybe there's something in the input with the surveyors that we can say, hey, what's going to make it easier for you to do your jobs, us to do our jobs, and let's build that into the training program. Spitball.
Yeah, well, I think part of it would be who's going to build the training program, right? So that could be where the funds come from.
I think that's where it happens, yeah.
That out, it's like consultation to be able to say, okay, can you build this training? Of course, with input, but from all sides. But then, could you build the training and actually operationalize it and make it happen? Because if MDH could do it today, I think that's what we'd be doing. But we're not resourced with those FTEs to be able to do it right now. So.
I think that brings up a good point that she had mentioned earlier, and that she kind of touched on, is that the funds that are in that bank right now are what's there right now.
Yeah.
A lot of times going bigger means continued funding, which, if this works, may not have that same level. And in the workforce that we have, it might not be desirable to have, build this or have an FTE of X amount for X amount of time, because then you get people who maybe are not as invested in it because it's not a permanent position or a permanent idea.
So how about we look at one, get feedback with Carol in our office about policy recommendations, the policy topics that were in the council's 2024 recommendations. And then also talk about, discussions about how to maybe operationalize this thought of having education toolkit, whatever you want to call it, to better inform providers, residents, family, public, those different models of like education about assisted living, home care. What do those all look like if you're going to go into those businesses? What does it look like if you're going to enter that as a resident? Having some of that, that seems like a good use of one-time money to create all those tools, have someone create those, and maybe that be some of the next steps.
Daphne, some of the information about when you're going to go into an assisted living or long-term care facility already out there, Minnesota Board of Aging or Senior Link, where they do the work themselves? The family.
Yeah.
I mean, that should not be on us. That should be on the family to do their own work.
Yeah, well, and
They should be advocating for their people, and they should be out there doing their own work. And then That is not on us because, you know, I was the provider for my mother and I was her advocate and I did my own work. And that is what the family should be doing for their person, not us.
Yeah, I agree with you, Gary. I'm just bringing up, there may not, and I can say at least for the MDH website, there's maybe not enough education, or at least just my perspective. There's not a lot of educational tools for them
Under the
on our
senior
side.
package and the Minnesota Department of Aging, Minnesota Board of Aging, there's information out there. And then you, frankly, you go to the specific facility and you ask questions.
Yeah.
Don't let them be all lazy and not do their work. The families need to do their own work because then when they come into the situation, well, this wasn't done or that wasn't done, that's because you haven't done your homework. The family, specifically. Just speaking from experience, from what I've seen of other families out there.
We should consider that not everyone has a strong family system like the one you are providing here in.
I think too that
on the facility. If
sometimes
you're putting your family member there.
I think sometimes the decision about where the person is going to go, assisted living, long-term care, whatever, has to be done so quickly that, you know, you might talk to somebody who has a relative in a, you know, in assisted living, but just don't have the time to do all those investigations, you know.
Or know the questions to
I know
ask.
the questions, yeah.
There are, I mean, we've talked a lot about providers, but there are other professional gaps that we've noticed at the department, ranging from folks that are building new assisted living facilities that, you know, like architects that don't understand the new requirements with how to build an assisted living. And so people are investing millions of dollars and then they're coming back and saying, and you know, and upset with us, but it's like, you know, come back to the department saying, but that's not how I did my buildings in 2019. The law's changed since then. And then they've done a lot of work that sometimes they need to undo. Also, we're noticing case managers not understanding a lot of the nuances and differences between assisted living and 245D licenses and thinking that they are the same services, care, and supervision. And so we've had a lot of folks with perhaps persistent mental illness or behavioral concerns, or folks that are actually supposed to be in the community, maybe getting home care services, that are being placed in assisted living, and it's not really the right setting for them. And so there's some other gaps and opportunities, I think, for education to be created that just currently doesn't exist to cater to maybe those professional types that we are trying to do more outreach with and having communications and speaking with from the Health Regulation Division. But those are more, I guess, professional gaps that we've professionalized, to say occupations, other occupations that impact assisted living that we've noticed. So there's tons of opportunity here for education.
Yeah, I also wanted to add, I know this is kind of separate from our recommendations, but I'm really glad you mentioned case managers, because one thing that I've definitely noticed, not just myself, but with tons of providers, is a lot of case managers don't know what they're doing. They don't know the regulations themselves. They don't know what's expected of them. And part of this is because they have high turnover rates themselves, but it's definitely, I would say, a huge issue actually. And I think if we're gonna have education, case managers should also kind of be formally maybe educated on what's expected of them. There's many times where case managers don't renew service agreements, or they don't check in on their residents, or they don't know what they're supposed to do. And so many times what ends up actually happening is providers have to kind of coach and teach case managers. And so I think with the whole training program, if case managers can also be brought into the fold, that would be really good.
Yeah, and that really gets into the payment side of things, which is a crossover to DHS. And I think that's where it gets, more challenging. Counties are experiencing the same things that providers and all other business lines are experiencing in staffing challenges and shortages and turnover. So you lose that knowledge when those individuals turn over. So again, I just really would say whatever is created, trying to make it as solid as possible, the foundation, so that it doesn't have to be changed, constantly, but it provides clarity as well as making sure that it's all connected. I think there's so many different agencies that are out there that provide good resources, but there's no real connection to those resources. And I think, as we were talking about residents or families navigating that, that can be challenging. And again, it's not just when there's a problem. I think the resources that are built are often to combat a problem instead of looking at it as helping inform people so they make the best decision versus getting into a situation that is not helpful. And it's only going to cause anxiety and stress for the resident, for their family, for the provider when it's not a right fit. And so the more that we can integrate and connect all of those resources and really keep the focus in the right vein will be really important.
Yeah, and I also think we kind of have a lot of pressure on providers, but case managers are just they're a very important piece that we oftentimes just forget. And so, sometimes they won't know how to complete a form or they won't do it correctly. And so, I agree, it's something that's challenging with the whole staff turnover and whatnot, and that may not necessarily be their fault, but I do think there's something that they should be held to where they have to kind of educate themselves instead of leaving that gap where providers now have to step in and coach case managers.
I don't know what kind of licenses different providers hold, but if you guys remember when we transitioned from the main community base 2021, we had to transition to assisted living. I can tell you for a fact that for a whole year and a half, some case managers didn't realize that certain facilities could not take certain age food. And I do know for a fact that some assisted living providers were taking some clients in and then DHS on their end having them to pay back, where in fact case managers approved all those rates, things and all of that. So thanks for bringing that up. It's a huge gap. So if we're going to be collaborative, that's a huge question that we cannot afford to leave out.
So, just watching time, I was just going to give a brief update survey, but to close this out a little bit, what I can do, like Carol said, she'll be out for 10 days, so it won't be this week, but I can write up some of what we discussed here today, and bring it back to Carol and talk about, how can we get maybe some of those small wins and looking at policy changes, but then also looking at this external education piece, and how we can go ahead and start moving forward with this education that we've been talking about that is needed, and whether that's outsourcing it or using these one-time funds to be able to resource it.
One thing we used to do in these meetings, was review the top 10 items, and the surveyor supervisors were in the room. And they were presenting some of it and kind of giving some context as this is what the surveyors are seeing, this is what we're citing. And we were halfway there. If we could take the next step with that, bring those folks back into these meetings and say, okay, how do we get information back out? How do we take this and make it actionable? Because we'd sit there and we'd look at the top 10 and every month it'd be the same top 10 and say, oh, here we go again. But yet we weren't taking that next step and making something actionable on it. And that's where we have an opportunity here without spending any money or anything, something we can do without even needing approval. Just do it. assuming those folks could join the meeting.
Well, we have yes.
Well, we have Jonathan and
Jerry.
Jerry from, yeah, so, yeah.
So, we can, yes, I mean, we do provide, to the various associations, we provide feedback on correction orders, and we present those at the various, assisted living summits, and I know we've got the home care, conference coming up. But it's still the education pieces. It does come back to education, because part of the top ones that are being cited are a lot of the physical plant, the food code, all those types of things that are for assisted living that are in that top 10 continuously. So we do give that information and the data on it regularly. But I think, and it's not that it can't be shared here, we can come back with that. I think I presented last.
We have done it off and on.
Yeah.
But the thing about it is we never take that next step and say, okay, why is this happening?
Yeah.
Because if the same top 10 are always the same, that many people can't be that wrong that many times. There's got to be something else in the mechanism that's wrong, whether that be interpretation, whether it be how the statute's written, how it's being enforced. You can't continue to be that wrong all the time. There's something else. It's not the people, it's the process.
Yeah, and I think that's how we got to collaborative safety, choosing the TB and IPP. I think now they've moved on to bed rails, which impact both home care and assisted living. Yeah.
But that process, right? I mean, we're 2 years in, we still don't have any results. I get it. I understand that there's a lot of moving parts there, but at that point, could we be taking action on anything? Could there be smaller steps in between, getting to that root cause? Could there be other things that we could be doing in tandem, right? And supporting that is actionable now, because I mean, I love the process, but it's not a quick process.
Yeah, and I think through our recommendations, we did touch on those, because if you look, and I'm speaking solely on assisted living right now, I haven't been able to dig into all the home care trends, and I would say that the top 10, a good portion of those are non-clinical. They're a lot to do with physical plant, environment, food, code, disaster, and emergency preparedness. And as we know, those were huge, heavy changes in licensure, and then there are less resources available to help providers understand that and implement it. So it's not surprising that they're in the top 10, since they're just finishing the first initial surveys. But I think we do and have learned some lessons that could help. But unfortunately, I know, Daphne has said that they've had limitations to being able to develop additional resources, especially in the engineering department. So if there's a way to tackle that, and if we could do that and move some of that work forward, that would be great. I think we'd see some changes and differences.
Well, that's a good lead in, so I can give an update. I think, yes, we can bring back, I think I would probably bring in Amy Hires, who's our manager of our home care and assisted living, and she can speak to what's being seen on the survey, what the primary issues are that are leading to the citations, et cetera. And so Amy can certainly come in and give that information. And that is what Michonne's talking about, that we've talked about the need to develop more resources, or survey tools, checklists, particularly with engineering, and some of those fire safety and disaster planning issues. We have currently hired 4 more engineers, engineering senior specialists. We started at the beginning of assisted living licensure in 2021 with 4 engineers, and now we're up to 12. And we're going to be hiring an additional 1 later in the fall. to support the license portability changes that just passed. So we actually are, with the current numbers, we are actually well staffed now to meet the survey demands. Barring another pandemic, happening, which should not happen, because it only happens every 100 years, right? But we are well staffed now. I think that engineering piece was a huge component and a big thing holding us back. Not having all the FTEs we needed to be able to have that engineering piece. For those that don't know, we have an engineer, a nurse evaluator, and a sanitarian to do the kitchen survey, the food code survey. And so that team goes out on every assisted living survey. We are, and having that full complement team completes the survey. So we having one position that's not well staffed holds back the ability to do the number that we need to do each week. But now with this additional staffing, we do a lot of math and calculations of how many do we need to do each week to be able to meet the current demand. We are, at this point, on a 3-year cycle for home care. We continue to do home care surveys over the summer and catching up on some of our T-Comp and T-Basic surveys, but paused a little bit on some of our routine work just to get this last push of assisted living surveys caught up over the summer. But we are on a 3-year schedule, which is what we're supposed to be on, to get home care scheduled surveyed every 3 years. We have been a little over 3 years in getting the first cycle of assisted living surveys done. We were still staffing up and training in the first 6 months after August 1st, 2021. So that delayed getting surveys done, as well as I said, we weren't able to get the engineering support that we needed at the time to be as timely as we would like to be. Because believe me, we want to be done just as badly as providers want to be done with this first survey. We want everybody to have gotten their first survey and to be successful and have that complete. We are within 3 weeks of getting the first cycle of assisted living done. So if people have not had their survey yet, heads up. It's unannounced, but heads up, we're almost done. And actually this is National Assisted Living Week nationally. So if people don't know that, Happy Assisted Living Week. So we are on the cusp of everyone that converted on August 1st, 2021, having gotten their survey. And moving forward, based on the current calculations, we are staffed to be able to complete it on a 2-year cycle. What we do know when we look at the number of applications that we're receiving in our plan review, which is usually application, pay your money, and then go to plan review for your building. In plan review, we're getting about 25 new applications a month. Once you put that number, though, up against how many we also know are closing, it comes out to about 177 new licenses a year. So when you project that out, of course, there's no evidence that assisted living is slowing down in the number of businesses that are being created. And so we are projecting at least 177 new assisted livings coming in the next each year for the next 2 to 3 years.
Those are brand new licenses, brand conversions.
Brand new licenses. Those are brand new licenses. Yes, so up to 177. And like I said, 25 coming into plan review each month. And so we're projecting that out. What is it going to take? Obviously, we would be in conversations, internally, but then also looking to the legislature. Obviously we will need more staff to be able to meet that demand, and we're adding 177 new licenses each year. We are continuing to get home care licensees, new applications and temporary comprehensive, temporary basic licenses being granted. But just due to the conversion and a lot of people closing, there were a lot of assisted living providers that hung on to their comprehensive home care because they didn't really want it to do with it necessarily. A vast majority of those have closed. And so we're sitting, I don't have the exact number today, but it was a little less than 600 home care licensees in the state. And
both basic and comprehensive?
Both together, yes.
So how many
2,209 as of like 2 weeks ago. And that number is always changing a little bit as the license closes and new applications come in. So we started with, for context, we started with 1,973 at the time of conversion on August 1st, 2021. So it's grown to 2,209 since then. And then projecting that we're probably going to have about 177 licenses per year for at least the next 2 to 3 years, based on what the current trend is of what's coming into the department over the past year.
And Daphne, what was the number you said for home care licenses?
Home care, I don't have the exact number at the tip of my tongue. It's just under 600 was the last licensure number I saw.
And Daphne, are you tracking the gain of units? I would be curious in those 177, how many actual like capacity is increasing? Because I think that also matters.
I don't have that number, Michonne, but that would be something we could look at and see. I can tell you that about 90% of what's coming into plan review right now is 5 or less. And about 3/4, which would be about 75% of the licenses that have been granted, the provisional licenses, have been 5 or less. So it's mostly the small provider that's applying and coming in as applicants.
Do we have any data on how many licenses are moving from provisional to actual?
I can get that number. I can tell you there's very few denied. The vast majority are approved. I just don't have the exact number.
Okay.
But yes, well, we'd be able to pull how many apply for their provisional and then we granted their full license. I just don't have that today, but the vast majority do get approved. They go through their plan, they become a provisional licensee, start caring for folks, and then get their provisional inspection. The vast majority do pass their provisional survey and are successful. But there's a handful that have been denied, but most are successful.
How many applications for the comprehensive? The 600 is the existing number, right?
Yes, that's existing licensees. I would have to get an updated number. We've been doing a lot of licensure cleanup. And when I say licensure cleanup, it's going through all of our data and just checking through and seeing, has this one closed? Is their data entry correct? And that's not done by it's in the health regulation division, but we have a whole licensing section that does that. And so I'd have to get a new data pool to see how many are temporary licenses versus fully licensed. So I don't have that number today, but I can get that.
However, application is still open for the comprehensive.
Oh, yes,
correct?
yes.
Okay.
We still are licensing comprehensive and basic. People are being granted temporary, comprehensive, and temporary basic licenses. And still conducting those surveys and granting full uncovered licenses. Yes.
So Daphne, would you say on the assisted living licenses then, if they're the 5 or less residential homes, they're mostly ALFs, less dementia care?
Yes.
Okay.
I think I've only seen 3. I've been going through the data quite a bit lately, just trying to see what our numbers are. I think there were only 3 that were ALF PC.
Okay.
But the vast majority are ALF. I think it's any to give you a little about our staffing. I guess, is there anything you want to know about our survey or things that I could bring back next time? I know we talked about going over the competent correction orders. We also see different things on complaint investigation versus what we may sometimes have for survey, just sometimes some nuances with that data and information. So we can certainly do that as well if you're interested in hearing more about our complaint investigation outcomes. And have a manager for that department as well if people are interested in that.
I mean, that gets to the public concerns, right? Like the complaint, we're assuming the complaints are coming from the public.
So,
Or so.
Yeah, so I would say, I would say at least half come from the providers themselves as mandated reports that they send to the MARC system of suspected maltreatment. Most of it's suspected maltreatment. There are some compliance only complaints that may come in, but it's largely providers and family members and just members of the public that we receive complaints from. They go through
do
the
you
MARC
trend
system.
that information? Where you watch, the data points? Come forward and informative of the council and how to send resources?
Yes, we do look at, we certainly have numbers about the types of maltreatment that we're substantiating, the numbers of complaints that we have coming in. We've had a little over 10,000 complaints a year coming into the department, and that's for both home care and assisted living combined. And nursing home, I should say as well. That comes, I'll have to get our most recent numbers. I don't want to say too much off the top of my head because that's never good. But we do have about 10,000 complaints that come in just related to maltreatment that goes through MARC. And then it's filtered to us for MDH licensed facilities. But I can get some of that complaint data for you, and you can look at what complaints that we're seeing, what types of complaints, and then kind of the percentage of maltreatment that's being substantiated. And then we do have the ability to break it down by facility type. So seeing where the majority of the complaints are. I haven't seen the most recent data, but typically most of our complaint investigations have largely been occurring, or where we've had substantiated maltreatment been ALFCs. Of course, those usually are higher acuity residents as well, and so higher acuity is more likely to have perhaps a poor outcome in an incident be able to happen. And so we do see a larger percentage of complaints in our ALFC.
Are there complaints that aren't MARC reports?
There are some complaints, only complaints that come into the department that don't go through MARC. Such as, I'm trying to think of what, some of the staffing is treated as compliance. Some depends on what the complaint is. Some of our infection control related complaints can be compliance only. Now we have physical plant things that come through. If there's a fire at the facility, we'll at least track and trend that and make sure we're aware of it. See if our engineer needs to go out and make sure that it's safe at the facility. Yeah. But I would say the vast majority of what we receive is
Daphne, I have a question. I'm wondering with data that's already available, and not just at MDH, but DHS with the assisted living report card, resident and family survey results. I know those are rolling up to a rating. However, that's a lot of data that could be looked at to determine how we could best impact residents' quality of life if we were able to look at so many trends or themes being seen in that information. I think it's more information or data that's available. Is there a way that they could provide some type of report? Not necessarily calling out locations, but if there's any themes that are seen in that, in
summarize what are high score areas across the state for these schools?
Possibly, but that would be, well, of course, that would be DHS is compiling that data, so we would have to kind of make that ask, I think, to see if I'm not sure how they're going to be distributing that data or who's going to be analyzing that data, but we could ask the question.
I think
to see
it might,
how they're going to be utilizing that.
Yeah, I mean, especially if it's a requirement that providers participate, it's a partnership in giving us a rating. There's data there that we can learn from that might influence quality. It's well worth, I think, the ask. And I guess I just wondered, Daphne, too, if we could just get a copy of those final recommendations that were sent. I would definitely support adding additional meetings, so we can either prioritize looking at getting some small wins on things that we could do now, as well as dig in a little deeper and possibly come up with some bigger ideas and or come up with more of an implementation strategy for some of the larger items.
See about getting final copy. Is there a want to meet? I have no idea what dates right now, but is there a desire, I guess, to meet before December 9th? By this group?
Yeah.
Okay. So I'll look at October and early November dates, just because I have no idea, because I think it would be helpful to have Carol back. And I don't know exactly what her calendar looks like right now. So I'll work with her assistant to see how to get good dates to get on her calendar. I'll try to keep it on, because Mondays seem to work, since people are here, so it seems like Monday works. So I'll try to look at what Mondays she might be available, and get us back together. And I'll work on getting a copy of the recommendations, and then also pulling together some data. So, yeah.
I had a question. Since this is my first year being here and kind of seeing the recommendations, my first round of seeing them, what is the typical timeline? Like from discussing it as an idea and then kind of maybe implementing it?
Jared?
We've never implemented a recommendation, so I don't know. We're gonna make that.
So I think historically, the recommendations had gone to the legislature.
And it'd be there by January, opening a session.
Yeah, and so it's kind of rolling the dice if the legislature's gonna do anything with it or not. It's completely in their hands then. Where now, the way the statute is written, that there's more control where the commissioner can work with the council to actually execute recommendations.
I think we got a much better shot now.
Yeah.
Okay.
Yeah.
Yeah, so there's not like a final end date or timeline put on us, but I know everybody wants to move getting things going for sure. And I completely understand that. I want things to move too. I would love all these lists of things to happen as well. It'd be great.
Take a win anywhere we can get one right now, right?
Yeah, it would be great. So, okay. So I'll work on getting a date. I'll work on putting, some for the next meeting. I'll work on getting a list of the final recommendations and putting some data together for this group. And then I'll also pick Carol's brain once she's back, see if there's any specific topic that she would like us to focus in on based on the conversation that we had. And then, can send that thought to you before the next meeting so that you think about it and maybe prepare a little bit your thoughts. Sound plan? Yeah. I appreciate everyone being here. We will definitely publish the date and announce the date of the next meeting that we'll try to do before our regular scheduled quarterly meeting. And we'll also save all the chat remarks, like I said, and we'll pass it along to council into the assistant commissioner. Okay. Yeah. Thank you, everyone.
Thank you.
Thank you. Everyone online. Thank you.
Yeah. It's also so now it's time for me. So the rest of me, You were considered just doing a
Don't touch on it. We did, when you mentioned thank you, like, low.
I'm Anna.
So I appreciate it.
You know, I'm right now in New Zealand.
So you know me.
I didn't know you would, like, one over the page.
It's a policy, and I believe we saw us in the application. I said, there's a lack of items here. I said, there needs, I said, where
Across the street
is
for us. But now I bet it's Memorial right after.
it helps see
Is the next.
individual home person, business person. But you don't break down. Or you go out and you thinking about.
Well, we have to have
This is, you know, of course, a lot of.
7 in Minnesota.
So,